Okay, so now we're gonna go through our sterile wound care checkoff. So first of all, your sheet says the supplies you need is gonna be your wound care tray, which should look something like this. You're gonna need your irrigation tray with piston syringe, the same thing used for NG tube. You're gonna need a couple of packets of cotton tipped applicators. These are in a different place in your guys' lab bag. It's in like a plastic bag, I think. You're gonna need a pair of scissors. And then you're also gonna need this drape, water resistant drape, okay? All right. So first thing we're gonna do is we're gonna prepare our patient. So we're gonna assess our patient for pain, medicate the patient for pain 30 minutes before we do this procedure because this could be painful for them. We wanna place them in a comfortable position with easy access to the wound. It's gonna be lateral for this checkoff. This is gonna be the exact same setup that you're gonna see during your checkoff here. So we've got our patient to the side, we've got our buttocks wound here that we're gonna be changing, okay? And then we want to place our water resistant drape underneath the patient. So I'm going to go ahead and open this. I'd like to also just let you know that this is not a sterile checkoff either, okay? So we're just looking to see that you know what you're doing and that you're following instructions as far as this video goes. There's no break-in sterile field in this, so we can kind of do this however we please. Put our drape under here to our patient because we're going to be irrigating this wound, okay? So we went ahead and set that up. So next thing we're going to do is we're going to remove that soiled dressing. So first thing, we're going to wash our hands. We're going to put on clean gloves, okay? So I've got my gloves on, and then we're going to loosen the edges of this dressing. Your checkoff sheet says things like raising the edge until taut, pushing the skin off the tape in the opposite direction. The point of that is because if you get an elderly patient who has very thin skin, you're trying to get off these dressings, you have to make sure that you're taking special caution in taking off these dressings so that we can not give their skin further injury. Okay, so we got rid of that. We're just gonna throw this in the trash here off to the side, okay? So now we've exposed our wound here. So at this time, we're gonna assess our wound for the type of exudate. So the drainage, is there any drainage? Does it smell bad? Is there any eschar? Which this is eschar here, right? So is there any eschar? Is there any slough in here? This is slough right here. This is bone. This is slough. Okay, so we're looking for these things. We're gonna say, what stage is this? Is there any redness around the wound? Is there any warmth? Any signs of infection? This is our big assessment right here after we remove that dressing, okay? Then we're going to remove our gloves, we're going to perform hand hygiene, and then we're going to go into our next step, which is irrigating the wound. So first things first, we're going to set up our supplies. So first thing we're going to do is open up our wound care kit here, which again, remember this doesn't need to be sterile. They give you a few pairs of gloves. You can just set these off to the side for yourself or whenever you need them. And then you're going to just pick up this drape. Remember, none of this part has to be sterile, so even though you see these packaged like this and you want to make sure that you're touching it all sterilely and whatnot, but you really don't have to. So this is just kind of for your own use and things like that. And then I just like to put everything on here that I think I'm gonna need. So I just completely emptied out this box, okay? I also know that I'm gonna need, I'm gonna need this piston syringe, so I'm gonna set that on there as well. And then this right here, I think this is a couple steps from now on your checkoff sheet, but right now while I'm messing with it, I'm gonna go ahead and put this under the patient's bottom right here, because I'm gonna use it to catch any drainage that when I'm irrigating the wound flows off into there. So I'm gonna go ahead and set that right there. I'm gonna give myself a little bit more space here. I'm also gonna open my cotton tipped applicators. I'm gonna open 2 packs. And now I've got all my supplies on there that I need. And that's good. So now that we've got all of our stuff on here, we've got a biohazard bag on here that I think it is convenient to open so that we can throw all of our trash in it. So you can open this and you can really set it wherever probably just set it right over here. Since this isn't sterile, I don't have to worry about crossing my sterile field. If this was sterile, I would maybe move that over here towards the head of the bed or something for easier access for myself. So next thing we're gonna do, we're gonna pour this normal saline here into this sterile bowl. You're not actually gonna open it during your checkoff, and you don't have to open it when you're practicing. You can just put it there. You can actually just like set it here, just say that you opened it, that's fine. Open it, pour it into that sterile bowl. And then you're gonna apply some clean gloves at this time. You can also apply a gown and a face shield as necessary because this is considered a splash zone, right? So first thing we're gonna do, we're gonna gently cleanse the wound with moist gauze by wiping from the wound center to the edge using a new piece of gauze each time. Okay, so that is these gauze pads right here. So I'm gonna open these up. I'm gonna set these in here. I've got my gloves on. And we're just gonna clean from the wound center to the edge. Throw it in the trash. Same thing with this one. And just make sure we do that till we get all the way around the edges, till we're cleaning the whole wound bed like so, okay? So that's how we're gonna do that. Then we're gonna change our gloves. Take our gloves off, get them changed, put some clean ones on, and then we're gonna fill up this piston tip syringe here with some saline, okay? And we're gonna irrigate. So we're just gonna fill it all the way up with our saline from this bucket. Woohoo! Fill it all the way up, right? And then at this time, we're gonna place, it says place this basin here so you can catch the runoff, so that's fine. We placed that a little bit earlier. And then we're gonna gently irrigate with a back and forth motion, moving from the superior aspect to the inferior aspect of the wound. This is just rinsing and cleansing the wound to get anything that may be stuck off of there with a little bit of pressure. So just kind of moving it back and forth like this, making sure that it's running off into our sterile bucket. And we just would continue to do that until we were satisfied with it being clean or until the solution runs clear. If you're rinsing and it's super bloody or super like serous sanguineous drainage or whatever, you would keep going until that solution runs clear off that wound. That's how we know that it's clean, okay? At the end of that, we're gonna get rid of this and we're going to take off our gloves, wash our hands again, okay? Now we're gonna apply new clean gloves and we're gonna measure our wound here, okay? So when we're measuring our wound, your kit comes with a measuring device like this. Wound measurements are always in centimeters. This is your centimeter side right here with the tiny ones up here at the top. If it's a perfectly circular wound, you can use this as well. I don't prefer that you use this in your checkoff because you need to know how to do length, width, and depth of a wound. So we're gonna use this centimeter side right here. So as we're doing this, first thing we need to do is we need to do a length measurement, we need to do a width measurement, we need to do a depth measurement. Okay, so when we're doing a length measurement, we need to make sure that we are measuring from head to toe. I just want to make sure that it has this, yeah, okay, measure head to toe, yep, perfect. Head to toe of the patient, so head to toe, so we're going this way, that's the length, okay? So we're just gonna hold this, go from one end of the wound to the neck to the very edge of the other side, okay? And we're gonna make a note of that. I would say this is probably 9.8 centimeters length. And then we're gonna go with the width. It's always length by width by depth. That's how we chart it. So then the width is gonna be from this side to this side. I would say this is probably 7.5 centimeters. And then we're gonna go depth, okay? So when we're measuring depth, if we can see this wound, it goes pretty deep. And there's also things in this wound that you'll need to measure in addition to just the deepest part also. You need to also notice that there's some undermining here. Right here is undermining, which we will talk about in class. And that's just where this kind of is a gap here. And then there's some tunneling here, and that's where it kind of goes. It makes a track, like a tunneling track through the skin there. So you want to make sure that you are measuring those. So first we're going to measure the actual depth of the wound from the top of it all the way to the edge of where your finger touches by taking this cotton tipped applicator. And then you're going to go down as far as you can where your fingers touch the surface of the skin. And then you would just take that and measure that on your measuring device like this. So if I measure the deepest part here, and my fingers touch the skin right here, that's what I'm gonna measure here on my centimeter side. So I know I let go right about here. It's about 3 centimeters in depth, right? But then this particular wound, we also need to measure the undermining, okay? So we can look at this undermining here, and we need to make sure that we measure it, but we also chart it as the face of a clock, as we do other ways. So we go in here to the deepest, we measure that undermining, it's about 2 centimeters, and then we also measure this tunneling. So we stick it all the way down to the tunneling part, and then we measure that, and it tunnels to about 3.5 centimeters, okay? So now we've measured everything we need to. We can toss these. And then when we're charting, we want to say, well, this patient has undermining from 11 o'clock to 2 o'clock, right? And then they have tunneling at about 7 o'clock, okay, on the face of a clock. Okay, does that make sense? And that's how you're going to kind of describe that. So now we have our measurements. We have, we did our tunneling, we did our undermining, we've assessed the wound. So now we're going to take off our gloves, we're going to wash our hands, and then we're going to start packing our wound, okay? So now we're going to pack and dress our wound. So I still have some gauze in here I'm going to get rid of, put that in our trash bag. And then we're going to take this Curlex gauze here, the one that's in a roll, and we're just going to put the whole roll and soak it in that sterile saline there. Okay, when it's done soaking, we have our clean gloves on. We're gonna pick it up, we're gonna wring it out. We wanna make sure we wring out all the excess moisture that's there, like this. Wring it all out. And then we are going to pack the wound. So when we're packing the wound, we wanna make sure that we're getting in all of these crevices and using only one piece of gauze. You don't wanna have multiple pieces of gauze in there that are free, or use a standalone piece of gauze to pack in that wound or in that tunneling, because then somebody might miss it and that gauze may stay in there forever. So one big long sheet of Curlex here will do. And you wanna not pack it super tight, because tightness, even if it's in a packing a wound, is going to inhibit blood supply. So you wanna make sure that you're cautious about that. A single layer and then a single layer on top of that until you get to the skin surface. And this takes some practice, but you're gonna use this cotton tipped applicator to help you. And you're just gonna kind of go in, I would start with the tunneling stuff here, kind of pack it in there, because the point of this when we're packing a wound, and this is actually dry, it's not wet, so it would be way easier if it was dry, but it's not. But the point of this particular thing is so that our wound can heal from the inside out, right? That's why we're packing these undermining areas. That's why we're packing the areas that are tunneling and things like that. And that's why we want to make sure that we're packing them loosely and not super tight, so that they have blood supply. And you don't want to let the gauze end up above the skin level. You want to keep it here at the skin level, okay? So you don't want to have like a big bulge or anything. So don't pack more than you need to. So I'm going to throw my applicator in the trash. I'm going to get my scissors because I don't need any more of this, and I'm going to cut this. Okay, I'll get my applicator back, a new one, and I'm just going to make sure to kind of finalize this. That's not sterile, so you can touch some of this stuff. I would just keep it to a minimum here. And then just do the best you can as far as that goes. Okay, get rid of that, and now our wound is packed, okay? After that, we're going to put on our Abd pad, which we have in our kit right here. It looks like this. And we're gonna just set it right like this. We're gonna get our tape, which we have in our kit. And you can just tape the sides of this like so. We'll tape all 4 sides. And then when we're done, we want to make sure that we label this dressing with the date, time, and our initials. Dispose of everything we don't need in a biohazard bag, which we have at the end of the bed. At the end, we'll clean up all our supplies, get rid of everything, and then After we label, we'll do our final steps. We will make sure that we document. We want to know our wound assessment. What was the stage? What was the drainage? Was there any eschar, slough? Where was the undermining? Where was the tunneling? What were the measurements? And then also the patient's tolerance to the procedure. Did they seem to be in pain? Did they tolerate it well? And then that's all there is to it.